right, I'm going to get started. Even though there are still people joining us, we have a lot to cover today. This is the third in our 6-part series on putting public health evidence in action to prevent and control cancer. So as we get started, if those of you who are CPCRN scholars can put your names in the chat so that we can capture the fact that you're here so we can report it to our funders, that would be great. So this is the outline for our training. And in our first session, we talked about engaging stakeholders, which is at the center of that circle and is at the center of all the work that we do. In the second session, we talked about understanding the problem and establishing goals for improvement. And once you've done that and you understand the problem in your particular community and setting and have established goals for improvement, the next step is to look for, find, and select evidence-based interventions, or what we will call for short EBIs, that you might use to address the problem. Oops, so the objectives for this session are, we're going to first talk about finding evidence-based interventions or EBIs, and then applying criteria to assess EBIs based on their effectiveness and potential for implementation in real-world practice, and then end by briefly discussing basic principles for selecting one or more EBIs that fit your objectives, setting, and population. So we're going to start with a poll, and what I want you to do, identify the place that you go to, your number one place. And I think Mary's going to set up the poll. This is just a listing, but a poll is on its way. There we go. What's the number one go-to place for you to get evidence-based interventions? And if you select other, which is here down at the bottom, please put in the comment what that other place is that you go to. Okay, I'm going to give it just like 10 more seconds. And then Mary, can you share the findings?
There you go. All
right. So number one place that folks are going to is the community guide, which is great. We're going to talk more. And I think next is going straight to journal articles. Colleagues, great place to go. And also the evidence-based cancer control programs is pretty high up there. And we're going to be talking more about that, and formally referred to as research tested intervention programs, or RTIPs. All right. Let me get rid of it. Mary, it's not letting me advance the slides. There we go.
There you go.
So all of those sites disseminate evidence-based interventions in one of 3 formats, either in the form of systematic review recommendations, which is the case for the community guide, packaged interventions, which is the case for the EBCCP, or evidence-based cancer control programs that a number of you noted, or in the format of journal articles. So the next few minutes, we're going to talk about the pros and cons of systematic review recommendations and packaged interventions as formats for evidence-based interventions. And then we're going to talk about how to search for and find EBIs. Any thoughts? Okay. I'm having a really slow response when I try to change the slides, so I apologize for that. So the first one we're going to talk about is systematic review recommendations. And so this is where a team reviews research reports on a particular type of intervention, and then based on what they find across multiple studies, of interventions using that approach, they determine what broad approaches to intervening are effective at improving the targeted problem. So if you go on the guide or the community guide and look for interventions for colorectal cancer screening, you'll find that they note that provider reminder and recall systems is a broad approach that's been found to be effective across multiple studies. The same is true for client reminders and reducing structural barriers. The strengths of systematic review recommendations are that they are the strongest source of evidence for an EBI's effectiveness because they synthesize findings from multiple research studies. A limitation is, although they provide the best evidence in support of effectiveness, they often provide only limited guidance on how to deliver and implement a specific intervention in practice. And so this is just to reinforce the idea that systematic reviews are the strongest source of evidence for effectiveness. And this is an evidence pyramid that shows that systematic reviews are at the top. So in the package of materials that was sent to you by Mary, there is a list of websites where you can search for evidence-based interventions. It's only some of the available websites. And with those, we provide the URLs to find those websites. Here are some of the websites that you can go to find systematic review recommendations. So you can go to PubMed. In other words, you can go straight to the peer-reviewed literature and look for published articles that report the findings of systematic reviews. You can go to the community guide. You can go to What Works for Health. And I noticed that a number of you identified What Works for Health as your go-to site. I love that website as a source for evidence-based interventions. And then the Cochrane collaboration, and several of you also identified that as a source of systematic review recommendations. Another format that EBIs come in is packaged interventions. And so this is where a team looks at a specific intervention and looks at the articles and studies that have been done on the intervention's effectiveness, determine whether or not it's effective and therefore merits recommendation, and then often works with the intervention developer to assemble a package of materials that includes information about the intervention along with various materials, protocols, and other resources to support implementation and delivery. And so the EBCCP website is an example of a website that disseminates packaged interventions. It disseminates a number of interventions for colorectal cancer screening. For example, the Smart Options for Screening Intervention and FluFit and FluFOBT program. The strength of packaged interventions is that they often provide detailed guidance and materials to support the implementation and delivery of a specific intervention. The limitation, however, is only a subset of interventions have been packaged. And in addition to that, the packages that are created may include materials and guidance that are specific to a particular population or a particular setting, or are more resource intensive than what you're able to do. So sometimes it's hard to find a packaged intervention that meets your need. So again, we have a resource listing of websites. These are just some of the websites, and we've been talking a lot about the Evidence-Based Cancer Control Program's website. SAMHSA also, and several of you identified that as a website. I want to point to countertobacco.org, which is a website that disseminates packages of guidance for policy interventions. So recommendations for policy interventions, and then resources you can use to enact those policies and implement those policies to counter tobacco marketing in the retail environment. So I want to take a few minutes to do an activity, and I know a number of you are familiar with the Community Guide website and the EBCCP website, but I want to make give an opportunity for everyone to have a little bit of time to look at both of those websites so that you can get a feel for how a website that disseminates systematic review recommendations might be different from one that disseminates packaged interventions. So in the materials that Mary sent to you, there were, I'm going to just admit this person. There were 2 documents, 2 versions of an evidence scavenger hunt. The first one has the questions. The second one has the questions with some guidance on how to answer those questions. So if you'll start with the one that just has the questions, and then if you need to refer to the other one for some help, feel free to do so. In this case, I'm going to have you each work on this individually for 10 minutes. Try to spend 5 minutes on one website and then shift to the other website, even if you're not done yet. I suspect most of you weren't able to finish that in the amount of time, but I'm hoping it gave you an opportunity to look at both websites. The first of which, just to reiterate, the community guide disseminates findings from systematic reviews of the literature, and the EBCCP website, which disseminates packaged interventions. And I also hope you had an opportunity to just get a feel for the different types of information available on the 2 websites. And we're going to talk a little bit more about those websites as we move forward. So the next thing we're going to talk about is how do you go about finding EBIs? And there are a lot of EBIs out there, and sometimes it can seem overwhelming. And this is a quotation from a public health practitioner working in obesity prevention, who says, honestly, the frustration right now for me is you've got Robert Wood Johnson, Policy Link, CDC, Convergence Partnership, you name it, and every day somebody is coming out with something. So we're going to suggest a strategy for searching for EBIs that we hope will make it more manageable. So we're going to suggest a 3-step approach. And throughout each of these 3 steps, you're engaging your stakeholders to help you sort through the EBIs you find and identify those that are the best. You're also going to be applying criteria. And after we go quickly through this 3-step process, we're going to start talking about the criteria that you apply at each step. So here's the 3-step process. We suggest that you first search for systematic reviews to identify what's been found to be effective across multiple different studies. What are the broad types of EBIs that are effective for addressing your problem? Then with your stakeholders and applying criteria, you're going to narrow those down to a subset. Second, we recommend that you search for websites for packaged EBIs. And you may find a packaged EBI. Ideally, you'll find a packaged EBI that applies one or more of the approaches you identified in step 1. The reason that's ideal is because you have the strength of the evidence that you get from a systematic review that supports your overall approach. And then you also have the specific details and guidance available through a packaged intervention. That is not always possible. And sometimes you will be working with findings from systematic reviews, and that's what you'll be implementing. So step 3, you search the peer-reviewed literature to update and fill gaps. So let's look at what this looks like, starting with the SMART goal that Mary set at the end of her presentation. So this SMART goal is by December 2021, 75% of your average risk patients between 45 and 75 years of age will be up to date on their colorectal cancer screening, with no disparities in screening rates for people of color. So in addition to that SMART goal, based on the work you did during your assessment and the work that was described by Mary in her presentation, you'll have additional data about the particular factors that are contributing to risk in your population. You'll also have some ideas of who you might partner with in terms of settings to implement, and the population you're intending to focus on to improve outcomes. All that information will go into your search for EBIs. So here in step 1, you might go to the community guide and search for what they say are effective, broad approaches for improving colorectal cancer screening rates. And here you see you might identify reminders, small media, one-on-one education, reducing structural barriers. You then might go to a website like the EBCCP to search for specific packaged interventions. And you might decide, together with your stakeholders and applying your review criteria, the FluFit FOBT program is a good fit for your work. Then in step 3, you search the peer-reviewed literature, and you do this with 2 primary foci. One is to update the information. So you look for articles reporting on studies that have been conducted since the program was posted to EBCCP, so that you can update the information that's available on the website that's disseminating the intervention. The second reason is you may very well want to look for people who have done studies with populations or settings similar to your own, so that you can get an idea of how others have used this intervention and potentially adapted it and modified it for populations and settings similar to your own. Another strategy, besides going straight to the peer-reviewed literature to look for these studies that have been more similar to your population, is to look at the studies that were included in systematic reviews of the literature to see if there are studies where people were working in a setting or with a population similar to your own. All right. Now we're going to talk about the criteria that you apply as you go through those 3 steps, and we're going to talk about 3 categories of criteria. The first one addresses how strong is the evidence for the EBI's effectiveness at improving the targeted problem. The second is what is the potential for implementation in real-world practice. And the third is how well does the EBI fit with intended population and setting. So we're going to just address this at a very broad level, the criteria that you would apply to assess effectiveness. But we're going to talk about 5 different categories of criteria under effectiveness. First is, what were the methods that were used to test the intervention or to review the intervention studies? The second is the number of studies testing the intervention and consistency of findings across studies. The third is the magnitude of effects. So you not only want to know if the intervention was found to be effective, but also how much effect did it have? So for example, how much did it increase colorectal cancer screening rates? You also want to look at effectiveness across subpopulations, and you're particularly concerned at looking at whether or not the intervention has been effective in the populations most at risk for the health problem, so that you're finding interventions that reduce health disparities, promote health equity, but also looking and seeing if there's evidence of effectiveness in a population similar to the one that you are working with. And then lastly, you want to look and see how current the findings are. So we're going to look at how these criteria would apply to the Community Guide website. And so this is the homepage for the Community Guide. And start by looking at About. So anytime you're going to a new website to look for EBIs, look at the About tab or whatever comparable tab that they have to see who created the website. And you want to do this to make sure you're getting information from a credible source and a source that's unlikely to have a biased presentation. In this case, it's the CDC, which is generally credible source of evidence. But sometimes pharmaceutical companies might disseminate interventions, or others who might have either an ideological bias or a profit motive. It doesn't mean you can't get good information from a website that has a profit motive. It just means that you need to look at it with an additional level of scrutiny. So also on the About page, you'll see there's a section on methodology. So you want to look at on the website and see if you can identify the methods they used and the criteria they used in systematically reviewing the literature. And in looking at those methods, look and see, are they transparent? Can you tell how they decided were ready for dissemination and were effective? Can you identify their criteria? Does it look like they used systematic methods in reviewing? So now we're going to go straight to one of the interventions posted on the Community Guide website. And this is interventions engaging community health workers to increase colorectal cancer screening. And over here to the right, I've blown up. This is an approach that's recommended with strong evidence. And I'm also have blown this up to show the date. So this review was completed and posted on April 2019. So it's current, which is one of the criteria we're looking for, is how current is the information. And then what the CP, which is Community Guide, what they found. And so here you come to the summary of results. And at the top, you see the number of studies that were included in the review, 66, of which 17 had to do with colorectal cancer screening. And if you look down here, you see what those studies found in terms of the amount of the magnitude of the effect on colorectal cancer screening. So if you look at that first bullet, you can see that there was a 12.5 percentage point increase in the number of eligible patients that were up to date with any screening test based on this particular intervention approach. And that was found across 9 studies. All right, so we're going to move on now to what is the potential for implementation in real world practice. So in addition to being effective, interventions also need to reach intended patients and populations, be adopted by providers and practice settings, be implemented with fidelity as, or in other words, as designed, and be maintained over time. So these are all criteria for assessing the potential for implementation. They're also all components of the RE-AIM framework, which is a widely used framework, and I'm sure many of you are familiar with it. And here on the slide is the website where you can find a lot more about the RE-AIM framework. So I'm going to go through these questions, and then we're going to do another hands-on activity where you get a chance to think through this. To assess reach, ask yourself, in prior studies of the intervention, did the EBI reach the intended population? So you would look both at the number who were reached, but also at the proportion of the eligible population that was reached. So if you were doing a colorectal screening intervention in federally qualified health centers, and those health centers had 1,000 eligible patients, so patients that had were the right age, were out of date with screening, and were low risk for colorectal cancer. So you have 1,000 of those patients, and the study reports that 100 of them were reached. So that's not a great reach if your intervention reaches just 10% of them. The second bullet addresses the question of whether reach was equitable across subpopulations. So in this case, with those 1,000 patients, if you imagine that 750 of them were white and 250 of them were Black, and of the 100 patients that were reached, all of them were white, you would that would be a red flag and a real concern for the the reality that reach is not equitable across subpopulations, and your intervention is in danger, in fact, of increasing health disparities instead of reducing them. Ideally, you want your reach to be greatest to those who are at greatest risk for the health problem. And then also make sure to engage your local stakeholders in conversations about their perceptions of how well this acceptable this intervention will be and how well it will reach the intended population. If we look at adoption, it's similar to REACH, except you're looking at settings and providers instead of individual patients or community members. So you would ask, does evidence from prior studies, the intervention suggest that organizations and providers were willing to adopt? Was adoption equitable across organizations? So are there some organizations, which may be your best funded organizations, that are reaching your less at risk populations are the ones who are most willing to participate in your intervention? And the more struggling or lower resourced organizations that are reaching your higher risk are not adopting, then you have a problem with the equitability of adoption. If you were to select this EBI, what organizations would make the decision to adopt and what types of professionals or lay people would implement, and then you'd want to engage your local stakeholders on their perceptions of acceptability of this intervention, enthusiasm for this intervention, likelihood to adopt it. And then for implementation, ask, do prior studies of the EBI provide evidence that it was implemented as intended in real-world settings? And this is an important question. A lot of times research is done in highly controlled conditions as opposed to real-world conditions, and then there's concerns about how well it can be replicated in real-world conditions. Second, are intervention materials and implementation protocols available and ready to use formats? And then again, you're engaging your stakeholders. So for this activity, we're going to split you into breakouts with 3 people. And so this again is going to be for 10 minutes. And in your package, you have a handout on potential for implementation. And that handout includes a table that is a lot of information about the knapsack intervention, EBI, which is an intervention for child care centers to improve healthy eating and physical activity. And this table shows you how both the effectiveness and implementation potential criteria have been applied to the research literature and information from websites related to knapsack. And so I want you to review that information, think about how ready this is for implementation, and then make a list of questions you would ask local stakeholders to better understand the EBI's potential for implementation. So I suggest you take a minute or two to introduce each other, and then take a few minutes to look at the table, and then briefly talk about how you might query your local stakeholders to better understand potential for implementation. All right, the current time is, so we'll come back at 12:47. All right, welcome back. So I'm now going to go to the EBCCP website and look at applying both the effectiveness and implementation criteria to information on this website. So again, you would go to the About website to see who created the website, although it's clearly labeled National Cancer Institute here, and also to look and see if there's information about the methods used on the website. This website has a great search page where you can put in all kinds of specifics to look for what interventions match your needs. But in this case, I'm going straight to one of the interventions, and this is the Flu FOPT program. And this is provides you just general information, but what I want to show you particularly is this part of the site where the website provides you with a score. Here to the left, you see a score for research integrity, which really equates to the methods that they used to review the intervention and what the score was that they gave the intervention based on those methods. So 4.7. Intervention impact is equivalent to magnitude of intervention effects, and a somewhat lower score for that. Then you can't quite see, but its dissemination capability is the last one, which is a component of potential for implementation. So you can see they give you ratings for those. And you can see at the bottom here, this little thing that says learn more about the ratings. You can click on that to get more information about the methods and criteria they used to give the intervention those scores. To the right, you can see that they actually apply the REAIM criteria in their review process for interventions and give scores for each of the REAIM. So a score for reach, effectiveness, which is another criteria of REAIM, adoption and implementation, and then again, a link to learn more about the ratings. Also, just want to point out yet again that a distinction of this type of website is that they provide additional materials for implementation. And this one also provides a link to the program developer, so you can contact them and ask questions. So this is a website activity that we often use when we use this training, that lets people use the list of resources that's in the materials Mary sent you and go to each of the sources and look at websites and see what information they're able to identify and if they can answer these questions. But we don't have time to do that today. So we're going to keep moving. Address the last of the criteria, which is how well does the EBI fit the intended population and setting? And so in considering fit, you take all the information that you gathered during your assessment, which is what Mary described in her last presentation, and you compare different EBIs in terms of how well they fit. And so starting with the health problem, does this, and that's, the broadest criteria, does this EBI address that problem? Does it address my more specific goal? Does it fit with my priority population? Does it fit with my setting? And then there's a list of other factors. And so that's where you get into the more detailed information you collected during your assessment as you tried to understand the factors that contribute to your specific problem. So if it's low colorectal cancer screening rates, do you have additional data that helps you understand why your colorectal cancer screening rates are low? Is it due to factors at the level of the patient? And what are those factors? Do patients not understand the importance of colorectal cancer screening? Are they unable to complete a FIT kit accurately at home? At the provider level, are providers not prioritizing colorectal cancer screening, or are they concerned that the patient won't be able to get a diagnostic colonoscopy if they come back with a positive test? So you also want to look for EBIs that, as well as closely as possible, directly target those factors that you identified as the key factors that are contributing to the problem in your setting and your population. And then lastly, you want to make sure that the intervention fits the resources you have available on hand. Does it fit with the staffing that you have, with the financial resources for materials and other things that you have available for the intervention? And so this is a tool. This is another item that Mary shared with you ahead of that can be used to compare different tools, different EBIs. So you can actually line up two different EBIs on each of the fit criteria. And then you can see in the middle here, it says, does this fit your audience? And you can check whether yes, it's a fit, no, not a fit, or it sort of fits in the middle there. Helpful for two things. One, it's helpful for figuring out which EBI is the best fit, but also even when you ultimately select an EBI, it's not necessarily going to be a perfect fit. And so what you learn from this comparison tool helps you figure out what you're going to need to adapt. And our next presentation in the series is on how to adapt an EBI to improve its fit. So you'll want to make sure to come to that one. So I have spent a lot of time on websites with systematic reviews and websites with packaged EBIs. So I want to make sure to remind you that it's also helpful to go to the peer-reviewed literature to update your search and fill in the gaps. So to summarize, when selecting EBIs, you're going to want to balance strength of evidence with fit. So ultimately, you're going to want to ask, how much evidence is there to support the effectiveness of the EBI? How much evidence is there to support the EBI's potential to be implemented in real-world settings? And how well does the EBI fit our problem, population, and setting? So that's the end of this session, and we would ask that you all please complete the evaluation survey so that we can continuously improve our trainings. All right, thank you very much.
Dr. Lehman, I had a quick question.
Yes.
So, and I guess it's related to the previous slide, but is there a specific guideline to follow as to when we should consider a certain EBI if it's, say, more dated? Like, for example,
okay,
say I find an EBI back in 2004 and I'm trying to do this now, right? So wouldn't that be
right.
a little...
So two things I would say to that. That's a great question. One is, if you find an EBI that was last tested in 2004, I would look for more current information, and that can be in the form of systematic reviews that support the overall approach, or more recent tests of the specific intervention. A lot of the stuff on the community guide has a fairly old date, and it's still good information, but I recommend people update it. The Using What Works is a great website to go to. It doesn't cover all areas, but for the areas that it does cover, it provides a lot of systematic reviews. That website does is review systematic reviews. So if you need to update an potentially outdated systematic review recommendation, go to Using What Works first to see if there's something there in terms of a systematic review that's more current that you can supplement. The second point I would make on out of date is, we didn't really talk about clinical practice guidelines, but most of the interventions were taught, many of them are in support of practice guidelines. So those practice guidelines change. So the age for colorectal cancer screening is getting ready to change. We used to tell women to do breast self-exam. Older EBIs, you're going to, particularly a packaged intervention, you're going to want to check through the materials. I work a fair bit in dietary interventions, and the dietary guidelines change. So review the materials to make sure the materials themselves are current with the latest practice guidelines.
Perfect. Thank you very much for that.
Okay. And so our time is up. Thank you for joining us, and we hope you'll, oh, I think I have one more. Do I have one more slide? I do. Don't forget to join our future presentations. Adapting EBIs is next, then implementing EYES, and we're going to end with evaluation. All right. Thank you very much.